Good day. As you can see in the present days of ours, the prevalence of hepatitis has been so rampant. So, what is hepatitis? Hepatitis is conjoined of two words, which is hepa and itis. Itis is known as inflammation, and hepa is a short form of hepatocytes, which are liver cells. Liver is the biggest organ in internal structure of the body, and the liver performs a lot of function. It conjugates bilirubin. Hepatitis is of two types, which is the viral and the toxic. The viral hepatitis is of 5 types, which we have the hepatitis A, the hepatitis B, the hepatitis C, the hepatitis D, and the hepatitis E. So the hepatitis A is a fecal-oral disease, which can be caused by lack of personal hygiene, lack of environmental hygiene, poor preparation of food, and poor food hygiene. It's a fecal-oral disease that can be cured even with the use of minor antibiotics. And we have the hepatitis B. Hepatitis B is one of the chronic hepatitis that cannot be cured with drugs recently, can only be maintained, and it can be transmitted through unsafe sexual intercourse. It can be transmitted through blood transfusion, and also it can be transmitted through organ transplant. So this hepatitis is the most worst part of hepatitis, and it has a complicated one, which is the hepatitis D. The hepatitis D is a complicated type of hepatitis B. So hepatitis D is a complicated part of hepatitis B. So how do you know you're having hepatitis B? Hepatitis B comes with a lot of signs and symptoms. The few signs and symptoms is 1. We have fever, we have jaundice, and we have clear coloration of the stool, we have detention of the abdomen. So if you are diagnosed with this kind of symptoms, or if you are feeling this type of symptoms, run to the nearby clinic or the nearby hospital for immediate help. So toxic hepatitis can be plant-induced, can be alcohol-induced, and it can also be chemical-induced. And we have alcohol-induced. The type of gin we take, the type of beer we take, can cause inflammation of the liver, because the alcohol contains a component called ethanol. Ethanol can get into the liver through circulation and causes destruction to the liver cell, and the liver cell is going to be inflamed. And we have plant hepatitis. Plant hepatitis or plant-induced hepatitis can be caused by exposure or eating of mushrooms and aloe vera, can cause the inflammation of the liver cells too. So the general signs and symptoms for hepatitis is 1. We have fever, we have jaundice, because the liver is the major metabolizer, and I say it conjugates bilirubin. So how do we prevent hepatitis? Both hepatitis A, hepatitis B, and even toxic hepatitis. For toxic hepatitis, the type of beer we take should be maintained. We should not take a beer with high ethanol, or we should not even take it at all. And for hepatitis B, we should prevent unsafe sex. The use of condom can be implemented, and also we can prevent multiple sexual partners. And for hepatitis A, our environment should be clean and good personal hygiene, good food hygiene. Our food should be well prepared. Thank you. My name is student nurse Alaro Olishola Yusuf. So for more health tips, you can subscribe to this channel, like, share, and follow. Thank you.